For this episode. Today, we're diving into a really important topic, how senior home care plays a crucial role in reducing hospital readmissions. It's a challenge that's been persistent in healthcare, especially for older adults.
Yeah, and what's interesting is that readmissions rarely happen because of some dramatic oversight in the hospital. It's usually these subtle, often overlooked issues that quietly escalate once someone gets home.
Exactly. People often think hospital discharge is the finish line, but really it's more like a handoff. Patients leave with a lot to manage: new medications, follow-up appointments, lifestyle changes, and they're often tired, medicated, and overwhelmed.
Right, and families are expected to absorb all that information quickly and then apply it in a completely different environment. The Agency for Healthcare Research and Quality points out that medication changes and delays in follow-up care are common sources of complications after discharge, especially for older adults.
That post-discharge period is really vulnerable. And the home environment is so different from the hospital. In the hospital, you have continuous monitoring, a multidisciplinary team, and immediate responses. At home, it's more fragmented: brief doctor visits, phone calls, and the family's best intentions.
Yeah, it's like hospital care is a high-resolution video feed, constantly streaming detailed information. But home care without professional support is more like intermittent snapshots, brief glimpses that can miss the subtle changes happening in between.
That's a great analogy. And those subtle changes, like confusion about medication timing, slight declines in mobility, poor hydration, or missed early warning signs, are often what lead to readmissions. Family caregivers might notice something's off, but don't always have the clinical knowledge or confidence to act quickly.
Which is where senior home care really changes the equation. Professional caregivers provide continuous, nuanced observation over days and weeks. They're trained to notice patterns, not just isolated moments, so they can catch those small changes before they escalate.
And their support goes beyond just observation. They help with medication reminders, encourage prescribed exercises and diet, assist with personal care like bathing and mobility, provide transportation to follow-ups, and even handle homemaking tasks that reduce fatigue and fall risk.
Plus, they act as a communication bridge between the patient, family, and clinicians. When something changes, caregivers can report it promptly, enabling earlier intervention.
That early recognition is critical. A client might seem a bit less steady or more fatigued, signs that might seem minor but can indicate serious underlying issues. Trained caregivers serve as an early warning system, knowing exactly what to watch for and when to escalate concerns.
It's important to stress that this monitoring complements medical care. It doesn't replace it. It fills the gap between clinical visits with real-world, continuous observation.
Absolutely. And to operationalize this kind of support, Right at Home offers the Right Transitions program. It's a structured approach that reinforces discharge instructions and provides consistent support during that vulnerable transition period.
Whether through formal programs like Right Transitions or individualized care plans, home care organizations tailor their support to reduce avoidable readmissions. It's not just ad hoc help, it's systematized and intentional.
And reducing readmissions isn't the responsibility of any single provider. It requires seamless communication among hospitals, home care providers, clinicians, and family caregivers.
Home care provides consistent visibility into what's happening after discharge, which helps the healthcare team make better-informed decisions. That collaboration mitigates the fragmentation that often leads to missed signs and delayed interventions.
So to sum up, readmissions often start with subtle, non-acute issues that escalate unnoticed. Hospital discharge is a complex handoff, not just handing over instructions. The home environment presents unique challenges that differ fundamentally from hospital care.
Senior home care offers continuous, pattern-based observation and multidimensional support, clinical, personal, logistical, and communicative, that episodic clinical visits can't provide. Early recognition by trained caregivers is key to preventing escalation and readmission.
And structured programs like Right Transitions show how home care can operationalize effective post-discharge support. Plus, effective communication and collaboration across care settings are essential to improving outcomes.
It's a complex, nuanced picture, but one that highlights the critical role of home care in bridging the gap between hospital and home, ultimately promoting safer, more stable recoveries.
Well said. Thanks for exploring this with me today.
Thanks. It's been a great discussion.